We've got a really nice spread of companies on the accelerator this year. The UK has got a real stage on an international level. You've got companies like DeepMind and a number of our other companies on the accelerator as well that are really pushing the boundaries in this level as well.
We're working internationally already, and what we tend to find is people face common problems. So the technology opportunities in terms of personalised medicine, how we create more efficient, effective systems, I think will be the same internationally as they are in the UK. The only difference is abroad they're working commercially, so if anything they've got a heightened need to drive efficiency because actually they're trying to turn a profit.
I think as far as the accelerator goes, we're really looking to use it to springboard a new cohort of 20 companies into the next era and looking proactively into the NHS and saying exactly where these new technologies can really take effect.
I tend to feel patients should control what's done with their data. It's probably a personal belief, and I think it will be ever demanded by our patients in the future. Really, it's their body, their health, their data, and up to them to decide what to do with it. What I think you'll find increasingly is as long as they feel comfortable that it will be treated with respect and with the privacy they expect, they'll actually want to share it, because in doing so they can improve the quality of their care.
I think being in a workforce constrained environment such as the NHS, where we've got a limited number of clinicians, to take advantage of anything like this would really need some level of technological innovation to help personalised care really take the next level. Traditionally, I personally feel that regulators have always been very slightly reactive and on the back foot when it comes to new technologies, because innovators would come up with a solution and then in response the regulator would try and understand how to best regulate that technology. In actual fact, rather than doing it that way, if the regulators were to take a front foot role and look at new technologies and proliferate ideas about good practice, that would probably be a much better role for regulators going forwards.
Flexibility is required in the future and innovation is required. Whether you're an innovator or a regulator, everyone needs to innovate, because inevitably the world is changing around us. So past regulation may need to change in the future to be fit for the future and make sure that we can put the patient's need first and deliver great care.